Taping techniques are used to prevent injuries. Among athletes, here are few common techniques in taping.
So this is the first step. I started with an anchor around the side of the foot. And I also put the tape around the heel cap. It's like the same thing, pulling from the outside to the inside, just a little bit of tension, pulling up on the plantar fascia. I use like 3 strips, but you can use how many strips you want, depending of the size of the foot. Next, follow with the teardrop from the base of the first metatarsal around the heels back to the base of the metatarsal. For this, don't apply too much tension of the strip because it can make the person become uncomfortable if we do. So here is step by step. So lastly, to finish this off, I close it in where I done going from lateral to medial, a little bit of tension, putting up the instep and medial seal. After this, I overlap the strap strip just by a few millimeters to keep it nicely. Lastly, I finish it off with an anchor close off all the ends to keep the tape secure. This technique is called plantar fasciitis strapping.
Shoulder taping for shoulder pain. Anchor and deltoid insertion. Start in proper posture. Wrap around front of shoulder with min-mod tension. Swing strips around your shoulder with 30 to 40% tension. Repeat base in the middle of your upper arm. Attach the last strip at the same base and follow the center line to the top of your shoulder. General kinesiology tape for elbow injury. Bend the elbow 90 degrees. Ensure a full strip on the outer arm 10 centimeters above the elbow. Stretch the tape moderately and apply it over the point of the pain. Then continue wrapping it around the elbow, ending it on the inner side of the arm and rubbing the tape to ensure it stick well.
Okay, for knee injuries, I'm focusing more on back of knee. Firstly, for the strip 1, start with a slap bend in knee. Place the anchor below the knee crease on the outside of the calf. Apply a light stretch to the tape and apply the other end of the strap directly across the middle of the quad with no stretch. As you straighten out the knee, smooth down the middle segment of tape to adhere to the skin. Okay, forward with a strip 2. Create an anchor at one end of the second strip. Place the anchor below the knee crease on the inside of the calf. Apply a light stretch to the tape and apply the other end of the strap directly across the middle of the quad with no stretch. As you straighten out the knee, smooth down the middle segment of tape to adhere to the skin. Smooth over the full application to ensure the tape is completely applied to the skin.
Start on the outside of the ankle with about 4 to 6 inches of K-tape above the ankle. Create a strip-like effect as we tape over the heel. Pull the tape to the opposite side over the inner aspect of the ankle and stop at the same level as the first piece of the tape. Put another piece of tape on the back of the foot while centering it with your Achilles or heel tendon. The ends of the tape are secured behind the leg. The tape should be tight enough so that when the foot bends it is still supported. Center a piece of tape under the arch and bring the two ends across the front of the lower leg to create an X. The ends of the tape are secured behind the leg. Mastering taping techniques can help in preventing sport injuries, especially among athletes